Hi, and welcome back. This is the Healthcare Nurse, and this time we're going to talk about the difference between using single essential oils like lavender or orange versus blended formulas. The thought of whether to use a single essential oil versus a blended formula is often a question which arises in the minds of those new to aromatherapy. Now, you might be surprised to learn that the answer to that question is quite simple. It really depends on your desired outcome. If you're having a party and you'd like to create a general atmosphere of joy and a good time, then using a single citrus oil such as Lycia cubeba would be fine. I chose that particular oil because it has kind of a lemon smell, a little bit different from lemon, and it's kind of exotic. I think you'll be quite happy with that oil. However, if you're using essential oils for healing, you're going to need to be a little bit more specific and know the chemical properties, or what we call chemotype, of the oil. Now, lavender is often used as an oil that's good for using for this or using for that, and some lavender plants are good for healing. However, all lavender oils are not the same, and even different varieties of the same lavender plant species will produce a different effect. And that's true for other single oils as well, essential oils. A lavender plant's potential for healing really depends upon where it was grown and how it was harvested. So how do you know which variety to use and for what purpose to use it for if you're using a single essential oil? Well, you need to have some knowledge of aromatherapy, and that knowledge comes from education and also available research. Now, when we talk about depression and anxiety, telling someone to use a single essential oil for something as complex as depression and anxiety, or even other mental health issues, is like telling a person with cancer to take an aspirin. Well, it may be of some help. Aspirin helps with pain relief. It helps to bring down temperatures. It helps to thin the blood. So single essential oils can help, but they just don't work to accomplish the goal that you're trying to have when you're dealing with things like depression, anxiety, or other mental health issues. Why not? The reason is because the brain is a complex organ, and it's constantly running and working very hard even when we're asleep. When it breaks down and it doesn't function normally due to illness or some kind of traumatic event that you've gone through, whether it be physical or psychological, or poor nutrition, then intervention is needed to kind of get it back into balance. Aromatherapy can provide that proper stimulation that's needed to bring it back in balance. Aromatherapy works through the olfactory nerve receptors, which are located in the nose, which have a direct link to the brain. That's why aromatherapy works. Aromatherapy can help. Now, you don't have to just take my word for it. There's recent clinical studies which were reported in many journals, but particularly in the American Journal of Nursing Science, which show examples of the efficacy of using blended oils versus single oils. In this study, it was reported that certain essential oil chemotypes in combination, which is blended, were found to have a direct effect on the brain. It stated that shortly after the oils were utilized, there were reports of reductions in depression, anxiety, and fatigue. But more importantly was the report of improvement in one's basic quality of life. Now, knowing which of these compounds to use and in which combination is essential to success when using aromatherapy to effectively heal. It was Albert Einstein who said, "Life is like riding a bike. To keep your balance, you must keep moving." Changing your mood and improving your quality of life is easy when using a blended formula which is designed to get you moving. This is the Self Care Nurse. Thank you for joining us. See you next time.